Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center. More and more frequently, I'm seeing people with various nose symptoms. So I wanted to just do a video. It's just going to be a general video. It's probably going to be relatively short, though any of you guys know I might go off on a tangent, so I can't guarantee it. But, there's just a lot of different symptoms, and people will typically see me or Danielle or come to Caring Medical Florida or the Hauser Neck Center because they believe, one is they likely have a structural cause for their symptoms, and two is they saw an ENT doctor, they saw a neurologist. Like I had a person, they saw over 100 physicians and nobody diagnosed them with the ligamentous cervical instability that we did. And you might say, well, why is that? Well, traditional tests that doctors use, it can miss ligamentous issues, because you got to realize the ligaments are like little screws. Like I'm looking at a camera stand there, I'm looking at various chairs here, I'm looking at a table. I guarantee you that camera stand, that table, that chair, it's held together by itsy bitsy screws. There may be 4 itsy bitsy screws, but yet the chair can handle 300 pounds, right? So imagine like the strength of that itsy bitsy screw, right? Well, that's how ligaments are. Ligaments are supposed to be rope-like, and when ligaments become string-like instead of rope-like, and they can't stop the dangerous movement of bones, it can cause all kinds of things. And according to Hauser's law number 2, if you have a chronic disabling symptom, so say somebody has, my nose is stuffy, I go to an ENT doctor and they say I have empty nose syndrome, in other words, the nose is clear. Like there's no obstruction of airflow in the nose, but yet I can't breathe through my nose. So according to Hauser's law number 2, if you have a chronic disabling symptom and nobody can figure it out, if you follow the neurology will lead to ligamentous joint instability, right? So we're going to talk about the neurology of the nose, and then I'm also going to talk about, and this is very interesting, like imagine like your nose is clear but you can't breathe through your nose. It's much like veins. Like I'll have people where we diagnose correctly that they have jugular vein issues, and then you clear up the jugular vein and they're like, Doc, I'm just telling you, I don't feel better. Well, initially I didn't realize they had venous congestion here also. So you clear up this, like imagine a person has, I can't breathe through my nose, then they have turbinate surgery, like they go to an ENT doctor. He's like, oh yeah, you got a deviated septum, your turbinates, they're blocking, there's not enough room. Then they open it up. Then the person's like, I still can't breathe through my nose. Well, it could be that the block is further down. There's an airway restriction further down, which I'll talk to you about it. But all these symptoms, runny nose, sinusitis, fluid in the sinuses, no numbness, no pain. I see all these things. Blocked nasal passages, clear watery discharge. Once in a while, it is a cerebral spinal fluid leak. That's why if you have a discharge out your nose and nobody can figure it out, please record it and send the recording to me, because it could be a cerebral spinal fluid leak, because the cribriform plate, or this part of the cranium behind here, it's very sensitive to increase in pressure, and that's right where the olfactory nerve is. And if you have distorted smell or distorted taste, that can be another sign that your brain pressure is too high. Loss of sense of smell or altered sense of smell, and of course head pressure. And then these are the turbinates. There's supposed to be a lot of room there for airflow, and these are the things that they open up sometimes when a person has nasal surgery because they can't breathe through their nose. And we should know it's very important to breathe through your nose. So when you breathe through your nose, it warms the air, right? It warms the air. That's healthier for you, because you got to realize your body temperature is 98 degrees. And I don't know if you ever take fluid, like if you had Coca-Cola or some fluid and you had it 98 degrees and you drank it, you'd be like, man, is that warm? Man, is that warm? Or you're in a pool, or you're out, like you know, when you're out and the temperature is 98 degrees, like that's the temperature of you. Like you're out in the sun and it's 98 degrees, you're like, oh my gosh, is it hot today? Is it hot today? Like I was sweating today, like it is February in Florida and it was like 82 or 83 degrees. And I was sweating. So you can imagine in summer when it's 98 degrees, but that's how your body is. And many times you guys, you know, you're up north, like think about the ambient temperature out there is like 72 degrees. You guys might be in the middle of winter, so it's 10 below zero. Like you can't have 10 below zero going into your lungs, right? Like that's not going to be good for your body, because then your body could get too cold, right? Like you can't have your body temperature go like 92 degrees, like your heart will stop or something. You know, it's very bad. Like you're supposed to be 98 degrees, right? So part of, to make sure that you're breathing warm air, it has to go through your nose. And you know, there's a bunch of nose hairs. And any guy, I'm 62, man, those nose hairs, I'll get back to the talk. Sorry about that. It's supposed to be a short talk. Empty nose syndrome. It's a rare complication that can occur before you get surgery on the turbinates, because basically the person has a feeling that the nose is obstructed, but it isn't. And you have shortness of breath, nasal dryness, nasal burning, nasal obstruction, feeling of suffocation, malaise, and depression. So I would say I see those things relatively frequently. So this just gives you some of the things. Sometimes it's from medications. Again, it's like a lot of things. People don't say that that's my only symptom. They'll normally say I got ringing in my ear, I got tenderness in my neck here, I got it's sensitive here. You know, I might have tachycardia, they might have some dizziness. So to me, it often is a constellation of symptoms that correlate with ligamentous cervical instability. So again, there's different etiologies for empty nose syndrome. I get involved when the person's still having a problem and nothing's helping. So it would make sense that that subset of people with a nose symptom that nobody can resolve, that it might have a structural etiology, and the structural etiology can be other things. Like look at this person. So this person might have, I got empty nose syndrome and I can't breathe through my nose. Well, why can't they breathe? There's an obstruction right here. This is the atlas. So you see that they do have an airway obstruction. It's just that the airway obstruction isn't the nose. It's just below the nose, right? So this person, they had such a forward head posture that they have a reversal of the neck curve. You could even see that they got some instability down here. So they need to have a looking up lifestyle. They got to stop looking down at their cell phone. They got to lay on their stomach, lift up their head, and then look at the cell phone that way, like on the ground. But you could see where you can have a restrictive airway obstruction and feel like it's your nose because you can't breathe, but it's actually in your neck. And then people who have fluid, like they don't have fevers, but they have sinus headaches, they have sinus pressure. So all that stuff can come from ligamentous cervical instability because the neurology is screwed up. So the neurology of the nose involves the trigeminal nerve. The trigeminal nerve, it goes all the way down to the C2, C3 area. It's called the trigeminal cervical nucleus. It can be affected by upper cervical instability. And then the sphenopalatine ganglion, that gives parasympathetic to the area, and that can also be affected by ligamentous cervical instability. And then we talked about the olfactory nerve. That's what gives you the sense of smell. So if you have a decreased sense of smell or altered smell, I recently saw a patient who they liked wine, and then when they drank wine, instead of tasting like wine, it tasted like vinegar. And you know, I've had other unusual smell symptoms. This is a common thing we see with intracranial pressure from jugular vein compression. So when the jugular vein gets compressed because of a forward atlas, like you saw, or C1, that you saw in that other cone beam that I showed you, that the airway was getting obstructed, well, if your atlas, the top vertebrae, goes too far forward, it can obstruct the jugular vein. This raises the brain pressure, which then can start affecting the neurology. So this says ligamentous cervical instability results in internal jugular vein compression and trigeminal-cervical nucleus dysfunction, leading to numb nose, cold nose pain, sinusitis, sinus congestion, rhinorrhea, excessive secretions from the nose. So all those things can occur because of ligamentous cervical instability. This just kind of is a diagram. Somebody has a face down, forward head lifestyle. Most of the people that I see, they don't know what is causing the problem. Once in a while, the person self-manipulates, or they got a too forceful or too many chiropractic manipulations of the neck, or they had a car accident or in sports and then it started after that. But most of the people, they have no idea, but they might be students. And most people, they're on their phones 10 to 14 hours a day. Then they're on their computer. So they, it's an awakening because they just have a massively forward head posture, which we show them on X-ray. So we do motion X-ray studies, which show the excessive movement of the bone, which shows the forward atlas. And so we start what we call carrying curve correction exercises, and we do ergonomic evaluations of their workstation and give them prism glasses, and all these things help to restore the cervical curve. And eventually the goal is to relieve the internal jugular vein compression, which that can cause all kinds of, altered smell, dysosmia and dysgeusia, altered taste. We help get rid of the vagus nerve neuropathy, or the sphenopalatine ganglion dysfunction, to decrease the runny nose, decrease the sinusitis, or just fluid in the sinuses. And then by restoring the neck curve and resolving the ligamentous cervical instability, the trigeminal works better. And when the trigeminal nerve is dysfunctional, it can give where it gives an altered sensation, or almost like a numbness in sensation. So in the nose, that can feel like I have a numb nose, or it can feel like, you don't realize, like when you're breathing, you can actually feel, you can feel it. So imagine if you're breathing, but you can't feel the breathing, right? Like, wouldn't that be odd? Like, I'll have people, they'll just say, hey, around my kneecap, I have a numb area. Like, it bothers them because it's just, they can't feel. So imagine there's people that can't feel the airflow. You don't realize you need that sensation just to feel normal, and that can be the trigeminal nerve. And I put this in here just to show you I don't know everything. I have no idea what this slide is, so I'm just being honest. And then, so if you have like a nose symptom and they do tests, yeah, it's going to show, like, if nobody can figure out like why you feel like you're suffocating, it's going to show that you have depression, you have anxiety. Like, if you feel like you're suffocating, it's going to show psychological factors which affects the nervous system and da-da-da. So I guess I'm just saying, before we say something psychological, why don't you look for a structural cause? And especially if you are the person you're watching this video for, like, a lot of people, they have friends who have these things and they're just trying to help them because they're in such a bad state. They're just trying to research things to try to see if there's anything that they can find that might help them. Like, in other words, ligamentous cervical instability can cause real organic sinonasal pathology, actual pathology in the sinuses. Like, you would be shocked at how many reports I get from the chiropractic radiology that looks at our upright cone beams, because we do the whole face, and it's like maxillary, sinus fluid, ethmoid sinus fluid, sinus fluid, sinus fluid. Then you go to the person, do you have infections? No. Do you have pressure? Yes. So if you have pressure like here or here, it's probably you got fluid in the sinuses. You don't need surgery. most of the time you just need to resolve the neurology, the problems with the neurology, which stems from ligamentous cervical instability. So ligamentous cervical instability can obstruct the jugular veins, which can affect the trigeminal nerve, can affect the olfactory nerve, and that affects smell, affects the nose. So if you have head pressure, with nose pathology or sinus pathology, it's likely that you have obstruction of your jugular vein. So in the office here, we do a lot of ultrasound evaluations of the jugular vein and can figure out which position of sleep will open up your jugular vein. And when we open up the jugular vein, normally the head pressure goes down. And if that's related to the nose symptoms, then the nose pain, the nose numbness goes away. The vagus nerve innervates all the organs inside of you. It innervates the lungs, it innervates the heart, it innervates the stomach. So if you have nose problems, but also your stomach's not working right, it could just be that you have vagus nerve pathology from your neck. So I just encourage you to watch the other videos I've done on the vagus nerve. So we do dynamic upright X-ray. It's called digital motion X-ray. So we take a motion picture of the neck. Then we check the jugular veins, the vagus nerve, and other tests that document the pathology. But the main pathology that we find is there's a breakdown of the cervical curve. So the cervical curve is supposed to go this way, but especially in young people, especially age 20 to 50, it's often reversed. Then we do basically a looking up lifestyle. If the atlas or the axis is very mal-rotated bad, we might send them to orthospinalogy, upper cervical, or NUCA chiropractor, some kind of upper cervical chiropractic specialist for adjustments. The reason why sometimes the adjustments are so helpful, because if somebody gets an adjustment and right away their nose feels better, like their breathing feels better, well then the atlas plays a major role in the pathology. And if they can't hold an adjustment, that's when they would consider getting prolotherapy injections to strengthen and tighten the ligaments. And all of us need to be on a looking up lifestyle, because a looking up lifestyle is healthy and a looking down lifestyle is illness. Thank you guys so much for watching.